Started because states bear some burden in the cost of Medicaid, and they came to the president, I think, looking for support in this and getting people to work. You say this is a bad idea. Tell me why.
Look, this isn't a new idea. It's been around for a long time. It was tested in the 90s, and it's found to do nothing except create a bureaucratic nightmare of red tape. It doesn't save any money. All it does is put an onerous requirement on people who are trying to work. The best way to increase employment in this country is to create jobs, not by taking health care away from people, not by cutting off chemo for somebody who's undergoing chemo treatment for their cancer, and that's exactly what this policy does. Medicaid is the largest provider of long-term care in this country, and this is just a sneak attack on the entire system.
And Alex, you say that most adults that are able to are working when they're on Medicaid already. But do you have a number to back that up? I know you say it's the majority of adults, but can you give me a number there?
I can. So even Heritage Foundation scholars looking at this see that it's a vanishingly small percentage of the 20-ish% that this policy applies to after you exclude the primary recipients of Medicaid, who are seniors,
kids,
children, and people with disability.
Okay, let me let you chime in. Go ahead, sir.
Yeah, well, so look, first of all, it's 40% of Medicaid recipients that are not working, that are able-bodied, and 40% of 70 million people is a very large number. And look, I will refute this. The goal of government programs should not be trying to keep people there as long as possible. We should try to get people off of government programs and back into the workforce. Medicaid was designed as a temporary health benefit for the working poor, not for people that want to turn a safety net into a hammock. We should try to get people off of government benefits and back into the workforce. And thanks to this booming economy, this offers an opportunity to do so.
And Alex, that's a very classic, Republican line, is that we're out here trying to get people off social assistance, off of, their dependence on government. And this sounds like a way that they're trying to do that. What do you say?
What this is it's the establishment Republicans again making President Trump a liar from his promise not to cut Social Security, Medicaid, and Medicare. This is an attack on the entire Medicaid system, including the fact that it's the largest provider of long-term care in this country. Nursing home care, $97,000 a year. That's what they're going after here, so don't think it stops here.
I mean, again, it doesn't affect elderly. This is for people that are able-bodied and under the age of 60 that can find a job, volunteer, or try to find a job. It does not affect elderly. Well, don't demagogue the issue. Come on.
It's a Trojan horse attack on the entire system.
Okay, well, you both have different numbers, and I'd be curious to see what the real numbers are, and I'm sure it's a tough number to find, is how many able-bodied people are not working while sitting on Medicaid, or I'm sorry, Medicaid, and that is at the heart of the issue, I'm sure. So, gentlemen, thank you so much for coming on this morning and debating your sides regardless, and thanks for dealing with the drilling as well. All right.
Thank you.
The drilling that will never end.
It'll never end.
It is 38 minutes after the hour. The NHL and the Army about to face off. The legal battle on the ice just beginning.
No citizenship, no welfare. The new